March 19th, Finance Committee meeting on H 861, an act relating to reimbursement parity for healthcare services delivered in person by telemedicine or by audio only telephone. First, witnesses, Sir Tisha.
Mr. Chair,
Yes.
I think somebody needs to turn off their speakers
Yeah.
and their microphone.
The mic is off.
You know, turn your speakers off. It's coming out of your PC.
Are you ready? Okay. Thank you for having me. Sarah Teachout, Director of Government and Media Relations for Blue Cross and Blue Shield of Vermont. You might eat your lunch here, some of them. I wanted to start with a little background because there's been a fair amount of history on what's what's going on in this bill. And to just talk about how health insurers have paid for audio only services, which are services delivered by telephone. So prior to COVID-19, telephone calls were not covered by health insurance. But during the pandemic, everyone, I believe, recognized how critical it was for people to be able to access their providers. And so we allowed both, and DFR required, but we worked with them on this, to be paid for what they consider triage phone calls as well as telephone visits. And so this bill deals with visits, not the triage telephone calls, which was, they were getting hundreds of calls from, Vermonters who needed care during the pandemic. So since the end of the pandemic, I would say the state of Vermont, the legislature, the stakeholders have struggled with what is the appropriate policy for audio only healthcare services. Most of the struggle has been around the payment for these services, not whether or not they should be provided. So the statute already requires that health insurance cover audio only visits. And what's being debated in this bill is the level of reimbursement for those visits predominantly. For the past 3 years, the legislature directed the Department of Financial Regulation to convene stakeholders and issue guidance on how to cover audio only visits. So they began doing that they started in 2021, but their changes took effect in 2022. They required that we all code the visits the same, which was super helpful so that we have data that can be compared on how audio only tele services are being used. And then they also put in a floor of 75% of an in-person rate for how or audio only services should be paid. So, and DFR did that for 2022, 2023, and it ends in 2024, their authority over this. And so the reason you have the bill before you is there's a question of whether or not you need to make a decision after 2024 ends. So I just thought it would be helpful to have that little bit of background, and I'm sure DFR would come and speak to you in detail if you wanted it. Blue Cross and Blue Shield of Vermont believes that the legislature shouldn't be setting rates for audio only healthcare services in statute. This is one of only 2 services, I believe, where the legislature is setting the reimbursement rates. It's out of context of kind of all the other reimbursements that we make for services across the board. And a 100% in-person rate is different for every payer. So what Blue Cross pays for an in-person service is different than many of our competitors, as well as Medicare and Medicaid. And we think that that is not a policy that works very well and is inappropriate in this context. And then just to tell you how much Blue Cross reimburses, so we reimburse 75% of an in-person rate, which is the minimum required by the DFR bulletin, for all services except for mental health and substance use disorder. Studies that our physicians review and data in the field indicate that for mental health services, that a telephone call, an audio only visit was equivalent or provide equally effective services to an in-person visit. And so we felt that because of that data and information, and also the need for mental health services in the state of Vermont, that it made more sense for us to reimburse at a higher level for mental health. So those services, Blue Cross has chosen to reimburse at 100%. It's not what's required by the DFR bulletin, but that's what we felt was the appropriate reimbursement for those services. One of the publications that we've looked at in the past when making decisions about how to reimburse for audio-only visits is one that I provided to the committee and is online. It's called Rethinking the Impact of Audio-Only Visits on Health Equity, and it's a publication from RAND. It was done in 2021, and there have been some updates that aren't quite as comprehensive since then. But what this study raised concerns about were how the ongoing delivery of audio visits could reduce the quality of care among low-income populations and contribute to health disparities. So that was one of the concerns raised there. It also referenced other studies that showed that clinicians can miss visual cues and struggle with establishing rapport with patients, and that audio-only visits tend to be shorter than in-person visits, like an equivalent in-person visit. And that patients report lower satisfaction and comprehension rates, which is critical for patients following medical advice. So those were some of the concerns raised by that study. They also noted that promoting audio-only visits could risk escalating costs and creating a two-tiered system in which affluent patients get video and in-person visits and low-income patients get telephone calls. So those were raised in that study, and those was one of the reasons we kept the non-mental health visits at 75% of the in-person visits. A couple other concerns that I wanted to just address up front, because we hear in testimony that Blue Cross and Blue Shield of Vermont, if the person schedules a visit that's supposed to be audio visual, and for some reason the visit can't be done because of technology, we still reimburse at the 100% rate. Patients are supposed to be notified by their providers that they'll be billed for an audio-only visit. That's required in the statute, but we still hear from patients who are surprised at the cost of a telephone call. They do call us and complain and say that they were unaware, or maybe they weren't paying attention, you never know, but they are surprised at how much the visit costs. These visits are provided for hospital-based providers and non-hospital-based providers, so any provider can do, as long as the service is appropriate to be delivered by telephone, any provider can do these. And what we've seen is an increase of 38.7% between the first part, the sort of COVID period of audio-only visits, and the more recent, since DFR established the 75% of the in-person rate. We're still seeing an increase in the cost of these. Some of that, I think, is being driven by the substantial increase in hospital prices for commercial rates. Another concern that has been expressed is that providers won't offer audio-only services if the rates are lower than those of in-person visits. Since 2022, the rates have been lower, and we haven't seen a drop-off of providers offering these services. In the Blue Cross and Blue Shield of Vermont data, we've actually seen a slight reduction in out-of-state providers who are providing audio-only services, and we believe that's because of licensing requirements. But we've seen the same or increases in the number of in-state providers who provide audio-only services to our members. And then the last thing that we've heard, we also have seen a drop off in the number of patients who are choosing audio-only services. So I think, and I gave you a data sheet that I wasn't going to go through, but there were about 15,000 unique Blue Cross members who were selecting audio-only care prior to 2022, and now we've got about 10,000 a year on average. So it just seems like, you know, some people would either prefer an in-person visit or an audio-visual visit. And then I'm just trying to talk about some things that I heard. So this is mandated to be covered by insurers in current law, so we don't feel that this bill is necessary. We did hear some concern that somehow Blue Cross or other insurers wouldn't pay an appropriate level of reimbursement if we weren't mandated by law. That's a little bit of a unique argument. There's many services that health insurers are required to cover, and we've never offered ridiculously low reimbursement rates because it's not a service we want to cover. And then what we would like to do is continue our current policy where we reimburse 100% for mental health services and 75% for all others. So I think that that leaves the legislature a few options. Certainly you could pass the bill as it is. We don't feel that the bill is necessary, but if you felt that it was, you could either put in statute what DFR has had in guidance for the last 3 years, which would be a 75% floor, or you could give the Department of Financial Regulation authority to continue setting guidance for audio only services. So that was the majority of my testimony. The bill does do one other thing. It repeals the sunset, which is set to expire on January 1st, 2026 for audio visual visits. So these are when you're Zooming with your provider. Currently, there's a sunset. It was set 5 years out on January 1st, 2026. So you're repealing it a year and a half early. And you know, the promise of telehealth was that it was going to lower costs by, you know, all these unique ways of patients being able to access care. And this would ensure that we will pay the exact same amount for telehealth services and in-person services. So I think we would recommend that you wait, don't repeal that sunset now. So that is the end of my testimony. I did provide some data to the committee. It's Blue Cross specific data, and I'm happy to answer questions if you have.
Senator Chitton.
So I think I heard you say that you have negotiated and agreed with providers to offer 100% of mental health services, and you have 75% agreement for all other services.
Yeah.
I guess my question is if this doesn't go through, do you also see likely on the horizon or circumstances where you are agreeing to other qualifying circumstances that might justify the 100%, be it like technology comfort levels, if they just can't get on a PC, types of services beyond mental health, or even if they are vision inhibited in some way? Is that likely to occur as well, or are there already discussions about other qualifying services that would get the 100% rate?
Right, so I'm not aware of discussions right now, but the team at Blue Cross who reviews our medical policies and our payment policies considers these all the time and responds to requests from providers. So it certainly is possible that we would consider any or all of those.
And those are always active conversations and negotiations that you have with the providers.
True. Yes, and we update our policies frequently. So.
Questions for sir?
Well, sure. Thank you.
You're not taking off those.
No, I'll stay right here and listen. Thank you very much.
Jessica Barner.
Thank you very much. Happy to be here. Jessica Barnard. I'm the Executive Director of the Vermont Medical Society, and it's my first time in this committee this session, so I'll just introduce our organization briefly. I'm also here on behalf of 2 other specialty medical societies. So we are the largest statewide physician and physician assistant membership association. We represent individual clinicians at all different types of employment settings, so hospital-based, at federally qualified health centers, independent practice, and also here on behalf of the American Academy of Family Physicians, so family practice doctors, and the American Academy of pediatricians. So a lot of primary care folks, but also specialists. And we strongly support H61 as a way to support practices in providing equitable access to healthcare services. And I just want to say from the provider perspective, I don't know that we've never advocated necessarily for telehealth as much as a money saver as a patient access issue and a patient equity issue, so that people can obtain services from their home, from their work site, if it's a secure, a convenient place, from their car. It is not reasonable that every patient, and one of the things we learned from COVID is not every patient wants to or can travel to the doctor's office. And I'm sure many of us in this room had this experience in the past 3 years since this technology really spread. And I appreciate Sarah giving some of the background. I was also planning to do that a little bit. So I know your committee hasn't necessarily spent quite as much time on the topic as some of the healthcare committees. So just want to highlight a little bit of what we see this bill changing and not changing. So most of the bill does not change the status quo for the coverage of telehealth services, except, as you heard, to move the floor to pay for audio only. Those are those phone calls, which is currently 75% of in-person rates to 100% of in-person rates. And I want to clarify, while DFR's order sets that 75% as a floor, that was really a decision by DFR. I would not characterize that as a negotiated agreement directly between providers and health insurers. In fact, most of these rates for the vast majority of providers are set in a community fee schedule, which is not negotiated by practice. It's one fee schedule that practices either choose or do not choose to participate in if they want to see patients covered by that insurer. So these are not directly negotiated rates. And all along, we have actually been advocating to DFR that we do believe these rates should be set at 100% of in-person rates, as they currently are paid by Medicaid and Medicare. Otherwise, Vermont statute already requires that payers provide coverage for audio-only services and audiovisual telehealth services. In addition, I want to clarify a couple of requirements in statute for providing audio-only and audiovisual telehealth services. What is a billable service will continue to be a billable service. This requires meeting coding guidelines for a full office visit. So we've heard some concerns, well, what about just calling in for a prescription refill or getting lab results called out to me? Those are not and have never been a billable service and would not be with anything in this bill. So most telephone only services, in fact, cannot be related to an office visit that occurred within the past 7 days, or a procedure that happens, or if there's a visit related that comes in the next day. So these are very clear time requirements in coding guidelines to prevent you just had a visit, you got a call the next day with some lab results. Now, that can't be billed. It has to be unrelated to a visit. So again, 7 days before, 1 day after. So if you call and say, I'm not feeling well, should I come in? That's a screening visit or a triage visit. That's also not a billable service and would not be. There has to be patient choice and consent, and we all of the stakeholders, I think that's very important. This is not something that is required of a patient, put on a patient. This is if the patient requests this type of visit. There are also, we have heard the concern about unexpected copays. That really, we hope shouldn't be happening. Statute again requires in that consent that a patient be notified if their insurer is going to be billed and if there is going to be a copay. So you shouldn't be surprised, oh, I thought this was just a check-in call, now I'm getting a copay. Statute allows payers to determine which services are medically necessary and clinically appropriate for audio-only telehealth. And I've included links to the policies from some of the major payers in the state where they list out which services that includes. So they don't cover all services this way. If a payer determines a service is not clinically appropriate to reimburse through audio only, they don't have to do so. So it's important to us to say, in our view, if the payer has determined this, that it is already clinically appropriate to be offered in this modality, the modality itself shouldn't matter. It's the same service, the same billable requirements, whether it's in person, audiovisual, or by phone. We've also heard the concern in the past, really starting early on with the COVID-19 pandemic, that providers might use the telephone to provide a high number of services or provide services when not appropriate. And now I'm really glad you'll be hearing from VPQHC right after me. Now we have data about this. And that's why the healthcare committees required that we code in a set way so we can really track these visits, and why the VPQ was tasked with coming back with a report to analyze how many services are provided this way and what types of services. So you'll hear from Allie again right after I am testifying, but I've included the link, I'll submit the link to their report. So this is a really small fraction of overall services. Approximately 6% of telehealth services and 0.5% of all services are the audio only ones. and appear to be a substitute, not an in addition to in-person visit. That was a big question people had. Are we just gonna be adding on more and more billable services, so we're adding to healthcare costs? That is not what the Vermont data shows. And the number of services and stable trends of the percent of visits show that that don't show signs of abuse or overuse. And I believe you'll be hearing from DFR. They were also involved in work on this report. And I pulled out a quote that they gave to their testimony at House Healthcare, stating that even if all telemedicine services were reimbursed at parity with in-person services, the overall cost would only have increased with medical trend. So they do not, they found their finding is that this would not increase healthcare costs. This is also, this again, in our members' views, and I've included some quotes also from where this is used. This is a really important access to healthcare services issue. So VPQ will also be showing the when this is most used for older adults, age 55 plus. Not a big surprise. The technology is it's pretty difficult to navigate. There can be trouble and preference to not connect over a computer and to use a phone. And also some really high needs types of services, cancer and leukemia treatment, heart attack and stroke treatment, more than things like, sick visits or even mental health visits. So mental health visits are not the majority of audio only visits. This is consistent with data we have from some of our larger healthcare partners we've been working with on this issue for the past couple of years. So we have some data from the UVM Health Network. Some of the most common reasons for audio only visits, follow-up type appointments, so medication management, adjusting medications or follow-ups, chronic kidney disease, prenatal visits, nutrition counseling, anxiety and pain. At Dartmouth Hitchcock, the most frequently used were for oncology, orthopedic surgery, heart and vascular surgery. There are many patients, and I just want to emphasize this, for whom the technological barriers continue to make audio visual impossible, and they need the audio only services around our state. So broadband access, affordability, computer equipment, comfort level of technology, and patient preference. So Dartmouth data also shows they have some data around why audio only visits have been used. That for 70% of the cases, it was patient preference. The patient actually preferred it. 22% was for technology issues, and then there were 8% for other reasons. So I would argue that the equity issue actually really flips in the other direction, that if we are not offering audio only services, we are cutting out patients who don't have broadband in our state, don't have the ability to afford or access the technology, or can't get in front of a computer. And that tends to be those, again, who are older in more rural areas of the state, communities of color. At Dartmouth, there's a lot of data about where these failed video visits happen. In the HSAs in Vermont, the Hartsville service areas, the highest failure rates, St. Johnsbury, Rutland, Bennington, Newport, Springfield, Windsor, and Randolph, and also highest with patients over the age of 65. So those who have lower socioeconomic status, resource challenges with transportation, time off work, childcare, potentially lack access to these services. I know Bi-State Primary Care Association, who represents the federally qualified health centers, has submitted some written testimony explaining the importance of access to telehealth services for patients of federally qualified health centers. And also really importantly, some new patient satisfaction data. Again, we don't want to be forcing this on patients. It should be working for everybody. And according to this survey, 87.7% of respondents were satisfied with telehealth services, including those who received audio only services. So to get to the crux of the matter of the reimbursement, because that's really, again, what this bill comes down to, is what should be paid at for audio only visits, and after 2026 for audio. What we hear over and over from clinicians is that using telehealth requires the same amount of work and expense as an in-person visit. In fact, sometimes more. Why is that? Because you might have to spend more time developing that rapport, getting to know the patient, asking questions you might be able to pick up just in person without being face to face. Asking a patient to demonstrate how something's going, or submit, again, set things up ahead of time, submit lab results ahead of time, or go to the lab, review those. The follow-up can be more difficult. So if the patient's right there in the office, they can just walk to the schedule or get that referral, get that follow-up appointment. But that actually may take 2 or 3 follow-up phone calls separately to connect all of those dots if they're not in the room with you. It requires the exact same clinical decision-making. So if you're meeting the requirements for a certain type of visit, all of those steps need to be made, whether the person is in front of you or remote. all of the same documentation, all of the same making of the notes. And there may be increased overhead costs, such as for the technology platforms, meeting security and privacy requirements. We had heard from some small, especially smaller practices, independent practices, that the 75% reimbursement level has either made them not offer it altogether, or B, just make it very limited. So really only offer it when it's the only option for getting a patient, even if a patient might prefer it, but if there is some way they can get in front of a computer or travel to the office, that is what they're requiring. And what are other states requiring? As of December 2023, 29 states have passed laws requiring payers to implement payment parity. 21 states have full parity, and then 8, including Vermont, have sort of caveats, Vermont's being that it's time limited. And as I mentioned, CMS, so Medicare, currently pays at the same rate as does Medicaid. And that's at least continuing through the end of this year. So for these reasons, our organizations, our members, the clinicians of the state strongly ask for you to continue parity for audiovisual telehealth services and those medically necessary, clinically appropriate services delivered by telephone. Again, I'll submit this in writing as well as some statements from our members about where they see this very important access need. Patients with HIV and Hep C in the notes, rural patients, more sick or elderly patients. So thank you for your time listening to this and happy to answer any questions.
Sir,
We'll go again. So I heard you say that this is only happening when patients choose or consent to it.
Correct.
I don't see that in the language here. Is that codified in statute?
That's
or-
underlying Vermont statute. Yeah, and I'll share that reference with you. It is in 18 VSA 9362, where they outline all of the consent requirement. And then the language is in, so that's the healthcare title under the insurance title 8 VSA 4100K is the sort of reimbursement requirements, including the medically necessary, clinically appropriate language.
And you're gonna.
I will send, yes, I will send
Thank you.
If I can understand better what it means when we say the patient has requested it,
Yes.
if you will. In my experience, when a family member calls a physician or physician's office to schedule an appointment, they're told where the appointment will be and that it will be an audiovisual appointment. The element of choice doesn't enter into the discussion. So I'm wondering how what that is meant when you say it's the choice whether the patient has asked for it.
So we're kind of using a number of terms here. There is a distinction in state law for consent to specific, the phone visits, the
Mhm.
audio only visits,
Mhm.
and that's, but there does need to be consent for both.
Mhm.
That in general, you are agreeing, you are doing an audio visual visit. I want to make sure I'm not speaking out of turn here. I want to kind of compare the language, but I know there is some separate consent language specific for the phone visits, and
Mhm.
that's where it is. The patient needs to, for example, understand if their insurance is going to be billed or not. There is, generally, I would say that in my experience, most practices still do give you the option, but it may be that if you want an in-person visit, there may be a longer wait. We've had long discussions about that up in the healthcare committees about is that acceptable? Should that not be allowed? And honestly, some of that is just the reality of how scheduling can work. It may be, yes, if you don't want to do this and you want to come in, that's fine, but we don't have a clinician available to see you for another couple of days where we could do an audio visual tomorrow. But there should be, and there are some providers, there's also been a lot of discussion around this, sort of the policy pros and cons of, do you need to have a brick and mortar Vermont presence? There are some providers who are purely, some mental health providers, for example, who only do telehealth visits. So in that case, you may not have an in-person option, but you would typically know that going in to see that provider, they do all of their therapy appointments online, for example. And there should, I would think if that family member, for example, said, I hear you're offering me an audio visual, but I really want to come in, when, that should be an option for in the vast majority of cases.
Well, I just wonder if that is, as a practical matter, a way of in fact, directing people toward that option because the alternative is not helpful, not useful, not reasonably available.
Yeah, and then that'd be, in my experience, it actually tends to be the flip, which is the default now that we're sort of out of the COVID, trying to keep people out of in-person is they schedule now people mostly for in-person unless you say I would like an audio visual.
Mhm.
It, interesting to hear. I guess it's not, I certainly understand, it could be the case that some practices kind of still have the other default, which is we're trying to schedule audio visual. We don't need, right, it's not clinically necessary. Now, in
Yeah.
all of these cases, in all, the statute's very clear, the same standard of care has to be able to be met. So if we think for your type of appointment, we really need our hands on some part of your body to see, or to take your blood, or to do whatever, then they should not, that should not be what's happening. It should be that they say, we need to see you. You need to come in, and then maybe if it's a type of appointment that they really think is best offered that way, maybe that's what they're offering first.
Well, I wonder if there are also circumstances in which you need a blood test or other kinds of things in connection with the appointment, and so people are driven to go someplace to get the blood work done and then have a telephone appointment thereafter, as opposed to.
Exactly, yes, that is definitely happening. So if you have a certain kind of appointment scheduled that is audiovisual, but they still need lab results or other data from a blood pressure monitor, they may say, please, enter all of your blood pressure readings into the patient portal, or please go to the lab, get this blood work done, then we'll have your appointment in a week when we have the results. That's definitely one of the ways to do it.
What my real concern is there real choice involved, or is the patient simply largely, in many cases, being directed toward that as a solution? And the alternatives are not readily available or offered.
I would, in my experience hearing from our members, the default really has moved back to in-person, and this is only being offered if it's appropriate or the patient requests. I can't say that there aren't some instances of that, but that's not how we hear most of our, especially primary care practices, using this service.
Other questions? Previous witnesses have said that the audio conferences are shorter than the visits. And that visits give an opportunity for visual clues and more thorough investigations, yet they're considered equal.
I guess I have two responses to that. I'm not familiar with the data showing for the exact same issue, the appointment lengths are different. What I will say is that the reimbursement for the typical audio only phone calls are based on time. So if they are shorter, you would actually use a different code and that you would get paid less based on. So the most common audio, well, I think most commonly used audio visual codes for audio only appointments are time based. And so it would, and you less reimbursement for less time. So if you are able to complete that visit in a shorter amount of time, you would get paid less. I will also say again that it does need to be clinically appropriate for that service. So if you can't pick up enough information over the phone, the provider would say, this can't be a phone. I need you to come in. My next appointment is tomorrow. I need you to come in person. But if you think about many types of visits that are being used, for example, think about a med check. You're on high blood pressure medication. Enter your last, well, let's have a phone call. Tell me your last 2 weeks of blood pressure readings. How much are you taking? Are you exercising? What are you eating? All that, information, let's adjust your meds a little bit like this. Let's have another appointment in 4 weeks. There are situations where it is the same information can be gathered, the same assessment can be done, the time can be taken over the phone. Not appropriate, and that I think why you see it for such a small, remember, this is 0.5% of all services. Many instances are not appropriate for phone. We don't argue that every service is, but when it is, and when the clinicians decided they can meet the same standard of care and it's medically appropriate, when it's on the payer's list of those services they've deemed clinically appropriate for audio only, those are the instances where we're saying, okay, we've already made this decision, it's clinically appropriate and medically necessary to offer this way. There's already a billing, you're meeting the billing criteria. In those instances, we do think it's equivalent.
Good.
Thank you. Thank you very much.
Those are the questions. Just.
I'm gonna try to work out this complex in technology. I'm really sorry for the interruption.
For the record,
My name is Hallie Johnson. I'm a quality improvement specialist with the Vermont Program for Quality in Healthcare. And I just wanted a moment to try to attend by Zoom so I can display the slides. They have some animation. Are you in receipt of the slides? Okay, great.
you gotta work with Zane here.
She's gotta join the Zoom.
Okay. Fantastic. It doesn't seem to be picking up or. What now?
Do you mind if I come over?
These.
Press buttons.
Record show this is an in-person visit.
Okay, thank you.
If he has.
Thank you for watching. Okay. Let's see, so. This is not a presenter view, so my notes have gone. Well, I'm just gonna continue. So thank you for having me today. As was mentioned, I co-authored this report on telehealth utilization analysis in Vermont for the 3 years prior to the 2 years prior to the pandemic, 2018-19, and the 3 years of the pandemic, 2020 through 2022. So I'm going to talk about the background of the report, the information we use, the 3 key questions we asked with the data, some findings. So this is a data heavy presentation and a note on quality at the end. So under 18 VSA 9416, the health department actually supported this work to examine Vermont population level health telehealth trends based on claims data. And I want to acknowledge VDH for the funding, and also they helped us access the data that were used in the project. And a special thanks, and Steve, if you're out there listening, to Steve Capel of Policy Integrity, who did the analysis and wrote much of the report. So I wanted to start with the information used. The data set is VCURE's Vermont's all-payer database. It includes healthcare utilization, costs, and resources provided to Vermonters and in Vermont. I'll just note here that this analysis focused on utilization, not cost or quality. That was the scope of the report. There are some limitations to VCURE's. It does not contain data on uninsured people or people with certain kinds of insurance like Veterans Affairs, TRICARE, federal programs, or self-pay or payers that cover a small number of lives, 200 Vermonters or fewer. And there's a link to the data reporting manual from the data set in your presentation. I also want to acknowledge the Green Mountain Care Board because they've been a great collaborator in sharing the data and reviewing these presentations and their data and findings as we go along. So I wanted to start with kind of what's included in the report and what's not. Here's a claim form. And we started with any service that generated a paid claim. So this excludes some of the things that we've mentioned already today. For example, calls with results that don't get billed and reimbursed, or communicating through MyChart or other help portals. We focused in on professional services. Those are services provided by an individual provider, and they exclude services that are provided in nursing homes and hospitals. Okay, then we only included the 5 largest payers. We were unable to include the payers that covered fewer lives because of some differences in the coding used and the reimbursement policies and just the small numbers. Okay, and then sometimes you can have multiple claims. A person has multiple forms of insurance. So we use the primary claim to avoid duplication. And I mentioned the 2 years prior to COVID and the 3 years of the public health emergency. So here's a little caveat. There was no, is this where I'm, yeah, okay. There was no flag that said, I'm a telehealth claim or I'm an audio only claim. It was very complicated and things were changing and evolving and providers and payers were adapting during the pandemic. So I'm just letting you know we did the best we could. Thankfully, we could rely on the help of payers and provider organizations to help us through some of this. And so the payers are part of a call and a group that helped us understand that we could land on these selection criteria, these place of service codes and the procedure modifiers. And then these are the codes that Jessa mentioned. These are the evaluation and management visits or office visits. The 3 different numbers represent, I think, 15, 30, and 45 minutes. And so it had to, yeah, so I hope I'm doing the selection criteria justice here. We asked 3 main questions. We wanted to know, how has telehealth impacted the use of professional services overall? You know, as Jessa mentioned, are we adding the services or are we substituting? Is the utilization, how is it being changed or is it? What are the patterns of audio visual and audio only? We were able to mainly differentiate between those in our data set. And has the pattern of the telehealth provider location changed? We knew before the pandemic, quite a few of the providers were out of state helping Vermonters. So we wanted to know, did Vermont providers start helping more? And this is our report. It is available on the VPQHC homepage. So this shows the overall utilization. So the dotted linear trend shows that for professional services overall, independent of the modality, in person, audio, visual, audio only, that over time they decreased. And you can see that with the solid line of the actual trend, the services decreased in 2020 and then rebounded and then continued with decline. Now I'll show you what's underneath that overall line. And here we see in gray the in-person visits, in orange the audio-visual visits, and that little thin line at the tippy top, the blue, is the audio only. Okay, this is data heavy, but I'm going to break it down in 3 sections. So here we see a table of the 5 main insurers, and then 3 years of the pandemic. And then those many individual rows are the modality of service. And so looking at total utilization, Medicare and Medicaid had the highest rate of services per covered person. Looking at audiovisual, people covered by Blue Cross and Blue Shield and Medicaid experience the highest rate of coverage per person. And then thinking about audio only specifically, we see that Cigna, Medicaid, and Medicare had the highest utilization. So, as we know, people with mental health, this looks at, so this table looks at the categories of ICD-10-CM, so the diagnostic category, a label for that, the description of that. So with A being infectious diseases, the next two columns show the number of services provided in 2022. We focused on this single year because the reimbursement and coding and everything had kind of settled down, and we felt we could standardize on this 1 year. And it's our most recent complete year of information. And then the next two columns say, like for infectious diseases, audio only 108 visits, divided by at the very bottom, 44,000 visits, that's 0.2% of audio only visits were infectious disease. Okay, or you can see here, I've highlighted that mental health had the highest percentage of all of the audio only, and it had the highest percentage of all the audio visual. However, if you think about if you want, so that's comparing mental health to all other diagnoses. If you think about the audio only piece of that compared to all telehealth within one diagnostic category, within one row, mental health actually used the least audio only relative to how much telehealth it was. Audio only percentage was the smallest, and for other, which is surprised us, because anyway, there were all these other physical health needs that use the audio only relative to the total telehealth. And so, as Jessica mentioned, people with cancer and heart disease had higher, here you see the cancers, neoplasms, in situ neoplasms, and blood diseases such as leukemia, showing this higher than average percentage of their telehealth being the audio only variety. And then also circulatory system diseases. So thinking about category F, that's mental health, and all other diagnoses, I'll refer to that as physical health. We see in orange, audio visual for mental health. In blue, audio only for mental health. In gold, audio visual for physical health. And in gray, audio only for physical health. And you see this, of course, huge, the big story here is the age bump in audio visual for people 10 to 34. This is where a lot of, and this is category F, mental health. So that's where a lot of the audiovisual utilization is happening. But if you look to these older age groups, and I'll be joining this in 6 weeks, you can see that the kind of the ranking order of the importance of these types of modalities changes. And in older age groups, use of telehealth for physical health becomes more common, and audio only also becomes more important here. So that was the heavy lifting. This is the last data slide, I think. So before the pandemic, the use of telehealth was quite small, and so I made a call out to show the detail of those tiny little bars for 2018 and 19. But these stacked bar charts show the location, like the office location of the provider, and blue being Vermont, orange New Hampshire, purple Massachusetts, yellow New York, gray missing, and green all other states combined. You can see prior to the pandemic, the smaller percentage of Vermont-based providers providing telehealth. And then shifting to the huge majority being Vermont-based providers providing telehealth during the pandemic. So it could be due to patients continuing to use local providers, but shifting to in-person service. From in-person to telehealth. So then moving away from the utilization data for a minute, just thinking about quality, since I do represent a quality improvement organization, I just want to explain that clearly more research is needed on the quality of care delivered through telehealth, including audio only. We have been looking at the national data and evidence, and every 6 months, we do a literature review and we find articles and manuscripts and include them on this tracking sheet that our payer groups in particular, I think, have found helpful. And I want to thank again all of the collaborators on the project, and this is how to find me. Be happy to answer any questions.
You didn't offer any conclusions regarding the quality of the research. Do you have any broad stroke thoughts on what the literature review you had on how the quality compares with audio only versus audiovisual?
Well, provider and patient satisfaction have been measured and they're both very high. In terms of health equity, there's a mixture of literature, and the more recent studies show that people and populations of focus, vulnerable populations do have better access as a result of telehealth.
Any other questions?
Appreciate your time and attention. Thank you.
Thank you. By the way, are you doing follow-up additional work based on what you learned there? Is it inspired like another round of research?
Well, we haven't taken on a new project to do the analysis. That would involve funding, mainly because we have to, our contractor would be involved to help with the analysis. We do continue to do the quality tracking on a semi-annual basis. I would say, Kathy, is it fair to say we would be open to a study given the funding?
Absolutely.
Yes, okay. Thank you.
I think Zane is down to get your party sponsor of 310. Any follow-up questions on H61? Having heard all the variety of this one.
I guess I was wondering, are we looking to vote it out today or if an H fell or?
We'll wait till chair is present.
Are we looking to get to the car insurance bill today?
Pardon?
Are we looking to get to the car
You don't
insurance?
have that bill. It's not in our committee.
Oh,
S-150, we were just asked to consider it, but it's still on the floor.
oh,
This is the insurance bill?
Yeah.
It's yours.
Yeah.
Will be reporting.
Yeah. we're good.
We're good unless someone has an objection.
I think Senator Sears wanted to know that. Well, I would update him today. Cause the last thought was, should we have him come in and talk about how they got a unanimous vote, but he's happy to either come in or just hear that we have no changes to the bill.
The chair has some concerns, but she's the only one that has articulated it. Unless someone else does. Senator Sears will be there for you tomorrow.
Okay.
Were you checking in on Senator Hardy?
I received an email 1 minute ago that she'll be here in 1 minute, so.
Okay. Thank you. Thank you all.
Thank you so much.
Sure.
Last person out now, we've got the door shut. I'll lose any senators.
Mr. Chair, talked to Senator Cummings on her way out, and S305, which you know from our work in South Natural, that we voted out that's on the calendar.
Which one?
That was PUC miscellaneous bill. She had said if time allowed, would I just walk the committee through it? I think it's referred here, but this committee is
You want to
interested.
start now and then be interrupted by Senator Hardy?
If you wish. I brought copies of the bill, so people may have to reading. It's on the calendar, but this is as voted out.
Do you want me to hand it to Mark or do you want to go to the chair?
You have one for the chair, maybe. 1, 2, 3. So, the PUC, pretty regularly, almost every year, maybe it's every year, comes across the street and says, we have some updates we'd like to make. Our committee also had an issue we wanted to address. They're both folded into this bill. The first section, starting line 7, page 1, is about the Energy Efficiency Modernization Act, which people might remember from 2020. And again, we passed it last year, 2023. It's a 3-year pilot that says that electric energy efficiency utilities can take a portion of their energy efficiency charge dollars and do work where they normally couldn't, which is in thermal and transportation. The whole idea was to sort of bootstrap, get ourselves learning more about what energy efficiency and greenhouse gas reductions in those sectors would be. So the changes start to really appear on page 2, and I'll back up, why are we making the changes at all? On the first pilot, everything, I guess, in terms of funding went as expected. Up to 2 million was allowed for all 3 years of the pilot. This past year, the PUC came back and said, we'll let you do your proposals for year 1 and the second year, 2-year period. But we want to ask more questions about years 2 and 3. The problem for the utilities was they were having trouble standing up and running a program if they were getting contingent funding, like, how do we do a pilot where you don't know if you're going to keep going? We had a conversation with the PUC and the partner, and the workaround, because it was almost identical language for the first time, frankly, we were surprised that they weren't awarded for the full money for the full 3 years. So getting these. And I'll just finish this one section so that it makes sense before we start. So the proposal from the PUC is, basically just tell us what you want to see happen and write that into the bill. Don't make a guess like how to evaluate. So the language that shows up on page 2, line 5 is a point under 3 VSA 209D2A. Like, what is that? Those are energy efficiency utilities, ET and for electric. But there's permissive language, may spend a portion up to not $2 million. That's the same figure, for 4 years running. Down below, there's a little more language related to communicating with other interested parties. The lines 11 through 15 say, when you're doing your pilots, communicate what you're up to with the PUC, the department, the DUs, and what kind of projects, pilots they're gonna do. That language doesn't change, so from 17 on to the next page. This is the language we've used, we used in the prior bill, and that's the criteria, what to aim for to accomplish under any pilot. That rolls on to page 4. Because the line 7 through 9 is struck because the PUC, like 1 minute more and then I will be done with that section, and I'll turn myself off. Is that okay with your chair? Okay, so we strike 7 through 9 at the request of the PUC. If they're not actually asked to evaluate according to those criteria, don't bother to take it out of the bill. Because they're also don't have that role anymore, don't ask them for a report. So 15 through 19 says you don't have to report because you're not evaluating the pilot according to those metrics. And that fixed the energy efficiency modernization portion of the bill. And with that, I'll pause to leave us in suspense. What happened to the clean heat standard that starts on line 12, page 5? Good afternoon, Senator Hardy.
Good afternoon, Senator
I
Bragg.
was vamping and filling until you.
Cool.
Now that he's totally confused us, it's your turn.
Excellent. I will try not to confuse. Mr. Chair, are you ready for S310? Okay.
You're right.
Awesome. Well, thank you, Senate Finance for having me. S310 is a bill about government response to natural disasters. And I talked with the chair yesterday and talked through the sections that I think are related to the committee's jurisdiction, because it's a very long bill. It's 70 pages long and has 38 sections, and most of them don't concern the finance committee directly or jurisdiction, but there are 4 sections that do, and so I was hoping to talk with you about those sections in the bill. The first, and there's a really helpful summary of the bill that was created by our amazing legislative council attorney, Tim Devlin, who's sitting over there. That
We
is,
have it.
pardon me?
We have that.
Oh, you have it. So that's perfect. So that's really a helpful guide. So part 1 of the bill, as part 1 in the summary, which are sections 1 through 4, create a community resilience and disaster mitigation grant program. So the grant program isn't so much relevant necessarily to finance, but the funding source for that grant program is. The grant program would provide grants to municipalities to be able to fund disaster mitigation or flooding mitigation, infrastructure projects, technical assistance for those projects, and improvements to stormwater systems and other municipal infrastructure, and the ability, the projects to adopt and meet the state's model flood hazard bylaws, which are really the gold star, but many of our municipalities are not able to meet those bylaws. So this grant program would allow them to get funding for doing that. This was taken from a bill that was introduced actually presciently last April, before we got the floods, and it created this grant program, and it was funded through a new assessment to insurance company policies. There's already an existing assessment to insurance that deals with fire and emergency medical systems. It funds some fire council training and emergency medical systems, and I'll get to that in just a second, because that's another part of the bill. But this would be a new assessment. As you can imagine, we got a lot of pushback from insurance companies about that, including some insurance companies that were here and were flooded themselves. Then we considered a couple other funding sources, but then ultimately where we landed is the raising of revenue is your jurisdiction. So we did not come up with a funding source and left it to you all. Thank you. But we did leave in section 3 of the bill, the grant amount, which as was introduced was $15 million. So obviously, if you do not find a separate funding source for this grant program, whether it's an assessment of insurance, or some people have suggested some kind of assessment on oil and gas or something like that, then the 15 million as it's drafted right now is general fund. Certainly could be reduced to a lower amount, but our committee felt strongly enough that this was a necessary grant program. As we've heard many people say, the flood last year cost the state $1 billion. And we want to make sure that we are mitigating the impact or the potential impact of future floods and natural disasters. So it is, in that perspective, a small amount of money compared to $1 billion. So that's the first part that is relevant, sections 1 through 3 of the bill. And then section 4 is, as I was mentioning, the Vermont Fire Service Training Council is funded through a current assessment of insurance companies that write fire, homeowners, multiple peril, allied lines, farm owners, multiple peril, commercial multiple peril, private passenger and commercial auto, and inland marine on property and persons situating in Vermont. It's a current assessment, and the funds go to train firefighters and to train EMS workers. As you probably remember and know, our EMS workers, our volunteers and paid EMS staff had come to us multiple times about needing more funding for training. So this would increase that assessment from 1.2 million to 1,350,000 and increase the funding for to the EMS special fund for training from 150,000 to 300,000. So it's just $150,000 increase for EMS training. But that would increase the assessment by a small amount in order to raise that extra money. This is an existing assessment. I believe there's a House bill that actually adds even more to this. So this is more modest than the House bill. But that's EMS training, and our first responders are really important to responding to natural disasters. We got some really good testimony from them about it. So that's that. So sections 1 through 4 are really.
Sure.
Very great.
Can you remind the committee what page 5, line 12, in terms of types of insurance, what allied lines are?
That is a really good question, and I don't know the answer. We did not get into the weeds of the different kinds of insurance, but I bet your chair knows, or maybe some other member, and I'm certainly, I know the insurance companies will want to come in and talk to you about it. So that is a good question.
Yet another moment of suspense in here.
Another moment of suspense, and when you get the answer, Senator Brady, please tell me. Okay, so those sections, then if you.
Just that, I mean, I think this is probably, this is where there's an appropriation and there's just a big section. One of the things we've been exploring in here is the National Flood Insurance Program. And I wonder if the $15 million and the grants awarded were contemplated in relation to ensuring those communities are meeting NFIP standards.
Yes, in fact, if you look on page 1 of the bill.
Okay.
In paragraph B, that in order to qualify for the grants, they have to participate in the NFIP program in accordance with federal law. And almost all of our municipalities do. I think there are only a few that don't.
Right, and that's kind of been the issue, is they participate, but what I understand from what we've heard, they have not necessarily met kind of standards for what would be for participation that would ensure that they are sort of remaining fully eligible.
what we heard in our testimony was that most of our municipalities do participate now, and I assumed that meant that they were meeting the standards, but that most of them are not meeting the standards of the state flood bylaws. And so we sort of said, originally, this was that they had to meet the state flood bylaws, but that would have eliminated a whole bunch of municipalities and sort of
Yeah.
said, you who are not meeting these bylaws can't get funding to mitigate flooding,
Right.
even though those may be arguably the municipalities that need it the most. So we changed it to, they meet this lower threshold in order to qualify for getting funding to meet a higher threshold. If that makes sense.
Okay. That's generally good. That sounds fine. I mean,
Yeah,
I think it was one of our fall hearings. We heard from the NFIP folks, the state level, that they don't even think some communities know that they are participating in NFIP and don't have a designee who knows what standards they're meeting.
yeah, and so I think overall, this grant program is the point is to bring everybody up, so they're mitigating their infrastructure and their bylaws, and the municipality as a whole is meeting the requirements of a higher standard, meaning the bylaws.
Yeah. And my final question on this section, you didn't contemplate a source of the 15 million.
No, and that's what I was saying is originally it was an additional assessment on insurance companies. We got a lot of pushback on that because there's already an assessment which funds the training. And then we contemplated other possibilities. We didn't land on anything. We felt strongly enough that we wanted the grant program to move forward in some way. And I said, that's really the jurisdiction of this committee, so love for you all to come up with a brilliant idea for how to fund it, and I'm happy to talk more about the details of what we discussed. But we felt, we were a little concerned about putting a funding source in here, throwing it over to you and having sort of the controversy kind of bubble up, so.
Right.
There's not a particular funding source right now. I mean, the funding source frankly is general fund, which
Right.
it's $15 million. I know that won't fly across the hall, so the options are either to create another funding source or to lower that amount, but I think our government operations, based on the testimony we heard, and we heard from dozens and dozens of people, is that this grant program is really important for municipalities to be able to do the work that's necessary to mitigate flooding and other natural disasters.
I have one more question, Ellen, I'm sorry. So just making sure, I believe actually NFIP lives in ANR. And then this money goes to public safety.
Yeah.
When I think public safety, I think emergency communications and kind of the response systems, maybe not necessarily resilience and mitigation. You all took significant testimony on DPS being in charge of resilience and mitigation grants?
Yeah, so DPS was basically sitting at the table with us while we worked on this bill throughout the entire thing. And so they were supportive. If you look on page 2, the program design is the Department of Public Safety in coordination with the Department of Environmental Conservation. So that's ANR. So since DPS and the Vermont Emergency Management, they are the ones that are working on sort of flood response and flood recovery. It seemed like they were the best option for where to put this grant program, knowing that it was also part of ANR, in consultation with ANR in the design of the program. And we were also trying very much to stay in our lane as the Government Operations Committee, knowing that the Natural Resources Committee was working on this sort of flood corridors and river corridors bill.
Right.
Or floodplain and river corridors bill.
Yeah.
That's why, and actually it was as introduced that it was in DPS, but DPS was supportive of it staying there and felt, comfortable, especially when we were talking about and then the grant awards also would be in coordination with DEC. So the two agencies, the department and the two departments in different agencies working together on the program.
Just to knit things together, if I may, Mr. Chair. Senate Naturals 213 bill, Flood Safety Act,
Mhm.
has the state on the floodplain fees, guys providing, giving new feet on that, bringing us to municipalities, working on the map. It also does technical support, it has the state developing model flood area bylaw, and then providing technical assistance to the municipalities that want to implement them, that all be encouraged to implement them. And then it has a study group to say, should we end up as a state saying they are required? But we didn't go all the way saying everyone must adopt the model bylaws. We said a stakeholder outreach, a study group will come back and say whether it's should become standard operating procedure for every town. And part of that is because right now there's 274 flood hazard areas, more than there are towns. There's all kinds of villages, and they end up being unique. So it's very hard for AR to consult when everyone has a unique set of bylaws.
Yes.
And so the idea was two things. One, standardize so they can provide more effective systems more readily to more people, more quickly, to be consistent. And the second thing is they are developing them to a more protective standard, higher elevations, for instance, so there's less damage
Yeah.
likely given the same flood event with current bylaws compared to the model bylaws.
Right.
Yeah, and the bylaws referenced in here are the model bylaws that Senator Bray just mentioned, and we have two members on our committee that are in natural resources in the morning, so a lot of it was, us checking with them, does this coordinate with what you're doing in the morning with the bill on river corridors, and so I think that we try to be as consistent as possible.
Yeah, I mean, I'm probing because now that it's in the money committees. You have the 4.5 million in your bill and the 15 million here. And neither has a funding source at this point, right? And
As a matter of fact, I was requested not.
I would know, that was a new thing to me, which I get, but I always thought it was more helpful if you bring your own funding source to the table.
Apparently not this.
Currently not, so I feel like there are some areas perhaps with these two bills where we may be responsive to trying to find $25 million overall or some amount of money. And some of these kinds of requests are included in that context. And we look for money that meets the specific need. But the question still, I think, would be, that's not mine to answer, will both of these survive separately in their own spots? And is there any value that appropriations will see to at least trying to get one pot of money out the door on resilience and planning and things like response? And then will we be asked to respond with a revenue source that's specific to flooding and disasters?
Yeah, and I think that's a great question, Senator, and I also was asked not to necessarily come with a specific funding source by the chair. In order to sort of avoid the controversy that might come with that funding source. But I do think the two bills, as Senator Bray said, knit well together and could be looked and perhaps should be looked at in the context of them both together. The 15 million, unfortunately, or fortunately, depending on how you look at it, is not the only appropriation in the bill. There's more. This is the only one that's in your sort of area in terms of the sort of the way it's structured, but there are more appropriations in the bill. But
In this, the governor has like nothing in this area.
the one thing is that there's additional positions for Vermont Emergency Management in the bill for the regional emergency management coordinators. Right now, there are only 2 of them. In current law, there are 2 emergency management coordinators regionally, so they have half the state each. The governor's budget includes an extra one, so there would be 3. And the GovOps committee includes even more, so we feel like having 7, so each coordinator has 2 counties each, or some very, maybe divided up a little bit more. Because what we were hearing in testimony is that there's an extreme lack of local capacity to deal with all of the emergency management planning and coordination and that VEM does a lot of that work with municipalities and with regional governments and organizations, and having those positions really boots on the ground across the state would be really important. So so there's a little bit in the governor's budget, but it's really only one position.
Think that
There's the other inconvenience that being tied or being directed to participate in the National Flood Insurance Program. That program is designed for the types of floods that do not happen in Vermont. And I think those are Midwestern, Central, Continental River floodplain flooding, not the fluvial events we have here. It just makes it more awkward.
We
There-
didn't.
I'm sorry.
Last complimentary piece, I suppose, is the Flood Safety Act stands up the model bylaws and the technical assistance from ANR. It doesn't provide technical assistance on the municipal side in case they need assistance working with ANR. So this feels to me like this could be funds that would help municipalities. We do municipal planning grants, we often.
Yeah.
That would be consistent with that pattern.
Yeah, I think the bills dovetail nicely. There are two other sections I want to draw your attention to that are relevant to this committee. Starting on section 18 of the bill, which is on page 44. And that was part 7 of the summary. This is related to the 911 system. And one of the goals of our committee was to really beef up and underscore and enhance our emergency communication system. So that includes 911, the BT alert system. I think we all, or hopefully all of us got that the Amber Alert test today. So that's part of our emergency notification system. If you're not set up to receive VT alerts on your phone, I highly recommend it. So 911, there's language in here that was developed jointly by the 911 board and the Public Service Department about carriers providing data to 911 on their sort of customer data so that the 911 would have more of the customer data information in the 911 system. And that is especially VoIP providers, the voice over IP providers. And then there's also language about those providers providing notification to their own customers when there is an outage. Right now, not all providers do provide notification to their own customers. So you might not have service and not know that you can't dial 911 because you haven't ever been told. I will tell you that there's concerns from the some of the carriers about the language in the bill. The language in the bill about notification is based on currently providers have to not notify 911 when there's an outage, but they're not required to notify their own customers. The language in the bill is based on requirements that are already in rule and also based on what is already the law in California. So these very same providers are doing this notification in California. And so that's where the language is modeled after for the notification for outages. So I'm assuming you're gonna wanna take some testimony on that, but my hope is that you can find a way to move forward with the notification, because I think it's really important that our 911 system and our emergency alert system have sufficient data to notify people during an emergency, during an outage, during a natural disaster, and that was our goal with this language. And we worked closely with the Public Service Department and the 911 board on it, or the executive director of the 911 board. And the last part of this section, there is, on page 48, section 20, there is a report back and a little bit of money to fund that report, to update, a report that was done in 2011 on the tariffs that the 911 board pays to telecommunications companies to provide that data. Right now, anytime they have to provide just one customer data information, the 911 board has to pay a tariff in order to get it. And the tariffs are quite expensive. The 2011 report showed that Vermont is paying much more than the equivalent amount in other states. So they requested that they could update, that they would be able to update that study from 2011 and hopefully reduce the tariffs and therefore save our 911 system a lot of money. The thought is that this $25,000 would be saved over many, many times from the results of that report. But I encourage you to hear from Barb Neal and the 911 board on that. So those are the 911 sections. And then there's just one, oh, sorry.
Yeah, I just had two questions on this section. One, directly to what we were just talking about, I think this is where the chair had expressed sort of like, oh, we need to hear about this and better understand it. Who is currently opposed to this section?
There are concerns from the telecommunications company.
Oh,
that sort of the telephone companies that, and they're, as you know, 3, maybe more different kinds. There's the VoIP providers, there are the landline providers, and then there are the cellular providers, and they each have slightly different opinions. We did hear from them, but they actually came to us pretty late in the game to express their concerns. So we did get testimony, and made some changes based on their testimony. But they, as I said, we worked with 911 and Public Service Department, and the telecom companies were pretty quiet until the last minute.
Okay.
So we, as I said, we have made some changes, but
Yeah.
again, I think they would want to take everything out of the bill, and I'm just encouraging you to not take everything out, to try to find a way to make it work, because I think it's really important to have the data in our system.
Okay, I had one more question. This was the only section I saw where it looks like we're trying to get at some of these larger concerns we heard about coordination, Vermont, Montpelier Alive was sort of like a starring role in helping Montpelier, even though they have no direct communication usually with Vermont Emergency Management.
Which section?
I'm using the summary, so I'm looking at the sentence that says representatives from local libraries, arts and culture organizations, regional development corporations, and local business organizations have been added to the list of non-voting members of the. So I think that's a good step. I hope this is some kind of that the emergency management committee, have regular enough communication that they don't feel like they've been put in the same position. I know that this adds more complication, but did you hear about one of the biggest disconnects I feel like I was hearing was our federal delegation doing their best job through their staff to make sure complaints went through them, because FEMA will have 5 lines only dedicated to complaints from the congressional delegation. And the aftermath where it took a while to know who from the federal delegation everyone was supposed to talk to. And I mean, I think they all did an amazing job, but I just wonder if you thought about any mechanism to have more federal delegation participation in the emergency management ongoing review.
So first, I want to say there are a lot of other things in this bill that I'm not going over into. the bill.
Yeah, sorry, I was just
Yeah.
reading that before we moved on.
But yeah, I mean, we tried to add more people to the sort of emergency management sort of coordination and planning system. We did hear testimony from our federal delegation on the bill, and the efforts that they made. We also invited FEMA to testify, and they declined.
they don't testify in state committees. We didn't add anything specific to communication necessarily directly with FEMA or with our
Mhm.
federal delegation in the bill directly. But what we did do was do a lot of work on improving planning and improving, who's in the loop and improving who's designated in each town and making sure it's really
Yeah.
clear and differentiating between the regional planning and local planning, the state planning, but trying to coordinate all of it. Trying to make sure that all the sort of after action review about what happened last year
Yeah.
is really looked at and really, and so some of that would probably come out in after action review. There is, as I know you're really concerned about, Senator, there's a whole section on language access in here, both for English language, people who don't speak English as a first language, but also deaf, hard of hearing. And so I think there's a lot about communication in the bill, but unfortunately, there's not anything directly with the federal government. It's really hard to sort of add them into the bill when we weren't sure how to add them into the bill. But the federal delegation, all three offices came and testified. And read the bill, and they didn't have suggestions for how to put them in the bill. So, I mean, certainly it's something that the House could look at adding if there's a reasonable way to do that, but,
While we're talking about like random connect, you brought up the language assistance, et cetera. I just wanna say, speaking of people who might have particularized need in an emergency, one of my students at the law school did their final paper on New Jersey and how they do a lot of disaster training with different kinds of disabilities in mind. That it's kind of written into their local and regional plans that they have to train using different scenarios that involve people with disabilities.
yeah, that's cool. That could be something that could be
I hope to
added.
forward
It is
to Jen.
It's not specifically in the bill right now, but there is a lot of training stuff in the bill, but certainly that specific component could be added. The last thing, in the section of the bill, it's part 10 in the summary, it's sections 25 to 35. We updated the emergency powers of the governor and emergency management. A lot of the statutes were written in the 1950s, sort of post-World War II, sort of, during the era of concerns about communism. And so the language was very much like about enemy attack and kind of old school 1950s era language. So we updated a lot of that. In doing so, we combined a sort of section of the statutes, there's a section in the statutes starting on page 64 that is related to the hazardous substances fund. And this is essentially for hazmat cleanup. If there's an oil spill or a chemical spill, this fund is used to clean up that disaster. And we moved a section about the fees and enforcement into the section that described what the fund was. So we didn't make any changes to it. It's just moved. So that's why it's in the bill. So just so you know, it's existing law. We didn't change it. But on page 65, there are a list of fees that are paid for each hazardous chemical or substance as defined by the State Emergency Response Commission at a facility. So if a facility has these substances, they have to pay a fee based on the weight of those substances. The only reason I'm bringing this to your attention is that it is a fee. We got the question of when were these fees last updated and how much money is in the fund? We got this at the very end of our work. So I said, I don't know, we'll have finance look at that. So if you're interested in learning more about the fees and how much is in the fund and if the fees are sufficient to cover what the fund needs, I just encourage you to take a look at that. That's on page 65 of the bill.
65.
Page 65. Yeah, we didn't make any changes to it. But we did get asked the question, I think literally on our last day, okay, I'll bring it up in finance to make sure if you wanna look at it, you can, so.
This used to be in Title 10.
We didn't move it to a different title, we just moved it to and I don't have my drafting attorney in here to help me.
It's Title
But
20, which
it's always been in Title 20.
which I don't know Title.
Title 20 is the emergency management and, I'm pretty sure, yeah, Title 20 is emergency management, and so. Or governor, it might be executive powers, but we didn't move it to a different title, we just moved it from a subchapter to a different subchapter within the same title. And Tim will be able to tell you the details of the drafting, but we didn't make changes to it, like I said, we just moved it and then it came to our attention, and so I just wanted to bring it to your attention.
I have a question if I may, Mr. Chair. Emergency powers. So I get it that we're not doing air raid drills,
Right,
that will cover. We did have a request in our committee to change emergency powers that we thought was much too unconstrained and far reaching.
Yeah.
And I don't know if that's a similar proposal was shot over to your committee, and if Mr. O'Grady, who reviewed those provisions on behalf of our committee, looked at anything related to emergency powers in your bill.
so Mr. O'Grady did not look, as far as I know, look at this language, Tim Devlin drafted it, and he consulted with Jennifer Carvey about it. Mostly what we did to be,
I mean, it may be completely distinct, but I just wanted to make sure.
yeah,
We didn't end up having something into another door.
Right.
The same council having this guy.
yeah, I mean, you can certainly ask Tim about that, whether he talked with Mike. The most of the changes we made are updating the language. We did get rid of some language that was sort of very open-ended. About, the governor can do this, and anything else, so there was
Sounds familiar.
there are a lot of open-ended things that we got, that we sort of closed that loop. There was, for example, from the 1950s, that the governor could authorize the temporary transfer of employment of personnel of the state government to the US Armed Forces. So basically, anybody who works for the state, the governor could enlist in the US Armed Forces during a state of emergency. That seemed a little extreme to us. We did ask the, yeah, we did ask the state archivist.
Siberia.
We did ask the state archivist if this power had ever been used, and to her knowledge, she said she didn't think it had ever been used, but it was clearly, like I said, it was drafted in the 1950s, a different era. So I don't think we made any really substantive changes, we made some updates and just sort of.
Part 10 language.
Yes, part 10 is the emergency powers of the governor. And that's the section that includes those fees, just because for some reason the hazmat fund is in that section, I think, because that's one of the ways that the governor might declare an emergency if there's a major emergency at some big company that produces chemicals or uses chemicals. So that is that. There is also, it's not really your jurisdiction, it's more appropriations, but just the last section 11 of the bill. And Senator Gray, I point this out to you specifically. This is the, as you'll recall from the BAA, we provided funding for July floods.
Stay in the sun.
Yeah, so this would provide the same treatment, equivalent treatment that the municipalities that were flooded in July for those municipalities that were flooded in August and in December. And the August list includes basically all of the Addison County municipalities, and then the December numbers, they don't yet have the data, but the bill is drafted as such that when the data comes, they can do the same math for those municipalities.
I'm not hopeful that our federal delegation, we get FEMA to change their disaster definition in a timely way. But it doesn't really correspond to the way weather can be damaging anymore.
Yeah.
It's not necessarily a singular event.
Yeah.
Cumulative.
That's kind of the first of my questions. I figured unless we have to hurry along, this was a friendlier place to ask just questions about different pieces of the bill
Sure.
than trying to do it on the floor. That's what Senator Bridges said was one of the first areas I need to know, which is, and then what about the January emergency declaration and on and on? I mean, did the committee contemplate developing a system of our own that tries to instill some sense of fairness? Moving forward, we're probably gonna have some kind of disaster every few months.
Right.
And how do we, it shouldn't be up to one member who's louder and can say like,
Right.
and I'm not accusing you of that.
That's okay, I'm happy to be the loud senator
Yeah.
who stuck up for my county. We talked about it briefly, you know, do we wanna create something more ongoing? But because we had already created the ongoing grant program, that seemed like we bit off probably
Yeah.
even already more than we could chew.
Right.
So what the goal was to just, for 2023, the year of the floods, that no matter when you got flooded, you got equivalent treatment and equivalent state assistance. Beyond that, and we just stopped at 2023, figuring the year is a good cutoff point. So I hear you about the December or the January windstorms, those were destructive as well, but we were just trying to tackle the 2023 flooding. I think there's an argument that we could look at that more, but I think that the grant program at the beginning seemed more to try to do the prevention and resilience work. So that we have fewer problems on the back end.
Right. I have several more questions. You know, I feel very strongly about section part 8, the emergency communications for language assistance.
Yep.
The $25,000 for outreach to increase Vermont alert registration, et cetera. I imagine that either content that supposes that they've already made sure that they are providing it in many other languages. 2 years ago, I said to them, I know your Vermont, the same Everbridge platform is used in California, New York, and places that have many languages. So they are already prepared to get these messages out in multiple languages.
So couple,
Yeah.
I can explain this section to you. So we added language about how all emergency communications needed to be translated or provide translation either through what's called picture-in-picture or CART, which I can't remember what CART is, but it's it's a way to translate for people who are deaf and hard of hearing. And then we also added translation services for people who didn't speak English.
Yeah.
And what Vermont Emergency Management said is, oh my gosh, we are not gonna be able to do this because we are not the television station that broadcasts these things. Like, if this is really the television stations who need to be able to provide the picture-in-picture. It's really little, it's literally a little picture within a picture on a TV. And then the translation services could be just, translated along. So they were like, wait, how are we gonna do that? So the Broadcasters Association came in and testified and said, we would love and the translation services. So we would love to help and have them on record, and Wendy Mays was really helpful in this area, saying we would love to help and they would participate in a working group to try to figure out how to be able to create that kind of translation services. And at the same time, they offered to do a sort of public information campaign to get people to sign up for the alerts.
Okay.
So this was sort of in conjunction with, we're gonna try to be able to provide these translation services for all types of Vermonters who need them. And we're also gonna try to get more Vermonters to sign up. So it's sort of simultaneous.
Talking about communicating with Vermonters about emergencies, on page 49 refers to service of emergency, line 13, services of emergency communications over mass communication platforms to, I don't know what it says, who operates those systems?
What, can you tell me which page you're on again? I'm sorry, I didn't.
49,
Yep,
page, lines 12 and 13.
right, okay, so the mass communications exactly are the television stations. And so, communications over mass communications platforms, television, radio, those are considered mass communications. And again, we don't regulate them, they're regulated by the FCC. So we can't require a television station to do translation. But what happened was the Broadcasters Association came to the table and said, we want to be able to do this and we would do this. Vermont Emergency Management can't do it because they're not the television station. But we can, and let's create a group to figure out how it would work, and so then we can have our members do it. And that's the sort of structure, and there's also a report, there's a sort of annual meeting with impacted communities to make sure that the communications are meeting their needs.
So who would provide the information?
The information, so the state would provide the information. So one of the things that we heard was, for example, the governor's press conferences where he was talking about the emergency and flood information. They had a sign language translator there, but then the camera would zoom in on the governor and the translator would be off the picture. So the fact that they were translating it didn't actually help because you couldn't see the translator. So that's why you need the picture in picture.
Right.
So that the translator is in this little box on the screen. Or the cart, which is, Tim, can you help me remember what cart is? Do you remember?
Yes, so I was concerned about where does the information come from?
Oh, the
It needs to be sent out.
It comes from the state, but the mass communication platforms are our
How
television
does
and
the
radio
state
station.
get how does the system get the information to the state that something needs to be done?
Well, it's really just in this case, the governor doing a press conference and making sure that those are translated appropriately for whoever needs them translated or interpreted.
I was trying to spoke.
Okay, I'm sorry.
It's not our jurisdiction was. If there's something that's going to hell in a handbasket, how does the governor find that?
You mean if there's an emergency?
Yeah.
Oh, well, I mean, I think that there's lots of different ways that the governor can find out. If it's a local emergency, the local emergency local emergency director, each municipality is required by law to have one. And they can communicate up to the state, to the Vermont Emergency Management Department. That, hey, there's a flood happening in Middlebury or wherever. So there's local communication up to the state.
Well, if the lines between Middlebury and Montpelier are down, what happens?
There are, you mean like the phone lines? Or for
The emergency communication lines.
I think that if the emergency communication lines are down, then Vermont Emergency Management would know that the lines are down and they would try to investigate as to what's going on. There are multiple avenues through which information gets fed up to the state about emergencies. And each of our towns is required to have an emergency management director, so that's part of the way. And then there are regional emergency management committees, which are have representatives from all the municipalities on them, and they also do that kind of communication. Also, the fire and police and the first responders all. Whoa, what was
That
that?
was, I don't know, like a car.
Big brother.
My
Flash of
question is, during times when poles and wires are down here and there,
Yeah,
what's the system that backs up the system where the poles and wires are down?
oh, so if you're not, so that,
Radio towers still charge.
yeah, I mean, I'm not an expert on how the sort of technical aspects work, and I would encourage you to hear from Eric Forand, who's the Director of Vermont Emergency Management. And I'm sure he could answer your questions, and he was an integral part of developing this bill and also runs the state's emergency management system, so I think he could answer that question. He also is a firefighter in Bristol. So he has seen it from both the local and the state level, and I think would be the most appropriate person. But we did try very hard to make sure that those communication lines were open and backed up. Meaning that there were people at the local level, the regional level, the state level, and public safety officials that were all communicating during an emergency. And we added people to the whole planning system in order to make sure that there were people at the table who weren't necessarily obvious, but we got great, for example, testimony from cultural organizations talking about during a natural disaster, they need to be at the table because there could be archival documents or whatever that are being flooded or something like that, so.
So, okay, I'm wondering who's responsible for seeing that they are backed up. And
Yeah.
The backed up system has been reviewed by us.
Right, I would ask Eric that question, and that's part of what we're getting at with the 911 language that's in the bill, is making sure that we have the sufficient data at the state level to ensure that our 911 system is robust enough to reach people as well. And that if there is an outage, that the carrier itself is reporting to customers and to the state that there's an outage.
There's a lot of redundancy.
Yeah, there is a lot of redundancy, multiple, as Senator Chittenden was mentioning, multiple powers that go on and offline depending on where you are. But again, I'm not.
I think it would be good to get Eric
You just look up.
on the list for testimony. I don't know if I can make that suggestion. I really want good answer from them about Everbridge and making sure all the settings, all the options that are available from Everbridge as a vendor are enabled, or there's voiceover in different languages, so no matter if you are reading a message or need a message said out loud, they have many languages in their portal that are available. And I have a hard time using the back end of Everbridge and Vermont Alert speaking English. So I'd like them to walk us through at some point what it means to give them more money to help people use the system. That's not easy to understand when you log on to the website.
Yeah, so we got some really great testimony from their like two guys that
Like Everbridge's guys?
no, they're the state employees who run this emergency management system, and they're right now in the middle of an upgrade to the system. So they gave some great testimony on the work they're doing in order to be able to have that kind of functionality in our system. And it's another reason why we need better data to make sure that the system has the data, and more people participating in it, so.
I won't ask any more questions, but
You can ask.
because having the data is one thing, transmitting it is another when poles and wires are down in different places, and who's responsible for seeing that the backup systems are there in place and ready. It's like, what happens when something is down and the circuits are severed? What? How does our system respond to that?
Yeah, I think that there are multiple backups and fail safes to the system, and again, I'm not the right person to ask that, but I would.
Who would you suggest we ask?
I would suggest you ask Eric Forand, the 911 folks, Barb Neal, and the Vermont Emergency Alert people who work for Eric. So maybe just start with Eric, because you don't have as much time. Please don't kill this bill. I want it to come out of your committee. So I would just have Eric in to go over how the system works. He's been great. He knows the bill well. And could probably answer a lot of those questions in one. You know, and make you feel more confident.
Thank
With
you.
the system.
Thank you.
You're welcome.
Senator Bray.
Well, I've noticed a certain breathless quality in the room ever since I asked this question. Now council's provided an answer. Allied lines are property insurance that is usually bought in conjunction with fire insurance, such as wind, water damage, and vandalism.
Oh,
And what?
Vandalism.
there you go.
Everyone can sleep easy tonight.
Thank you for that. And CART means what, Jen?
CART means communication access real-time translation. It's the word that would appear at the bottom.
And that's for people who are deaf or hard of hearing.
Yes.
Because a lot of people who are deaf and hard of hearing do not speak sign language. And so this is something that we heard, a lot of people think, oh, if you're providing sign language, that you're doing it. And CART is really important for people on their screens to be able to read what's going on. And we got testimony from somebody who didn't ever find out about flooding and needed to in, I think it was Wyndham County, because he didn't speak sign language, but needed the CART translation.
I'm at the point where I use closed captioning on most of my shows, just to make sure I actually understood what was being said, so
Yeah,
it's useful to everyone.
yeah, so, and also there are different kinds of language translation services, some are better than others, so making sure that the type that we get is sufficient and not, as my mother would say, gobbledygook.
Mr. Chair, are you moving us along, or,
I hope so.
okay, do we have other I don't have the agenda. We have the topic.
All right,
I have 4 more questions that I can find you about.
okay, I'm happy to say, I don't know what your agenda is, ours kind of got blown out of the water, so I'm just at your service at this point.
We need more specific questions to ask.
Senator.
I don't know
Collins,
if mine are specific, but do we need to move on? We have some.
The other thing on the agenda is him also speaking about this bill, so.
Oh, okay, so you're okay with me asking my 4 specific questions?
Go ahead.
These 3 of them represent kind of the other concerns I heard about the flood that I wonder if you've taken away some lessons that are reflected in the bill. Number 1 is having an identified shelter that is accessible to most Vermonters. The second, do you want me to list them?
Sure, go ahead.
The second is just a coherent volunteer management system. That was a problem in Irene as well, like we have Serve Vermont, or we're supposed to have like a tiny volunteer workshop, but like it didn't function to my knowledge well in this disaster either. 3, there's a section on 211 and information privacy, but my understanding was that there was some gap in the information that 211 was able to provide a lot of communities that made the information rendered kind of non-usable for those communities because it wasn't complete. My final thing I just wanted to say, and I don't know if Senator Chittenden has thoughts on this as well. It's funny to me that you have a section on disaster management programs at UVM and the state colleges. When I was the student body president at UVM, that meant I had to serve on the pandemic planning committee that's required for accreditation. So accredited universities are required to do pandemic and disaster planning regularly and include 1 student. They often have a better disaster plan than the local community that they're in. I remember we had to determine that bodies would go like on the ice rink if it was needed by the city of Burlington, et cetera. It's a little morbid, but are you looking at their disaster management planning processes, or just that they would create like a major or a minor or something for disaster management?
So the latter, so this is a report back about whether they can create a program to train people in disaster management. And
Mhm.
get maybe an associate's or a bachelor's degree or whatever, or BS in that disaster management.
Yeah.
And we, this came to us, one of our witnesses suggested this. Actually, it was Dan Smith, who is the former chancellor, I think, of Vermont State College System. And he said that he had been working on something like this when he was there. And he thought it was a great idea, and even more now so, even now more so. And Eric Horan said that he was very supportive of it because he needs more people who are trained, who can work at the state or local level in disaster management. So this is just a report back from UVM and the state colleges about whether or not they could create a program like this. They both are supportive of telling us what they think. So it's more to have an academic or training program than to talk about their own planning. And let's see, your question about the shelter. Yes, there's a provision in the bill about creating, and it would be done in conjunction between Vermont Emergency Management and the Agency of Human Services, because AHS is in charge of mass sheltering during an emergency. And it would be a report about their mass sheltering. Also, mass sheltering is part of the state emergency management plan, which we codify in here. The emergency management plan is a thing that already exists, but it's not in statute, so we codify it in statute. So mass sheltering and emergency shelters were definitely part of our planning. And we also, I believe, require that local or regional emergency management plans have a shelter designation as part of their plan.
Okay.
So I'm gonna interrupt here. Our jurisdiction is raising money and overseeing communication planning and the utilities that provide the notification and emergency services that they are ready to operate and back up from. And we're getting into areas that are worthy of being dealt with, but not our area of jurisdiction.
Does 211 count as our jurisdiction or no?
211.
Not really, but I can answer quickly your 211 question. I do think the section on 211, and that's something I was going to flag to the House to do more work on. We did hear a lot of concerns about the confidentiality and who that information was provided to, and we heard some kind of sketchy testimony from one of the national vendors who got a lot of that data. And that also, when there's an emergency or natural disaster, there are national volunteer organizations that descend on states. And a lot of those volunteers are sort of beyond the control of any state organization and entity. But part of the emergency management plan for the state is about volunteer management. So that is, yeah. All right, and I'm happy, Senator, to talk to you more about any of the details.
Thank you.
Yeah. All right, I'm gonna thank you all. This was a fun conversation. Please treat the bill well. It's, I think, really important for the state, and I thank you for your time and consideration. And Senator Watson and I are both available if you have further questions about the bill.
You want this out for B25 or?
I want this past this section, Senator, and it has to make a trip across the hall as well. Thank you all.
Well, yeah, there is money in it, right?
Thanks for having the record to nothing of the council. And I apologize, I had to step out and I missed the majority of Senator Hardy's testimony was on the House floor. So, but I'm happy to provide any answers to questions about the words on the page or any legal issues that may be presented or take notes on how the committee may want to amend this. So.
Senator Chit.
Page 47, lines 9 through 16. Just sense problem or interpretation, and I'd be curious from a lawyer's perspective. It states that every originating carrier shall, according to the rules adopted by the E911 board, notify its customers, and the 911 service provider and the board of planned or unplanned outages that impact the customer's ability to complete a call to communicate with. I Googled the definition of notify and it is very reactive and not very proactive. And I just want to be sure we can't notify people of unplanned outages. So this is the requesting of the carriers to state clearly and publicly in this next sentence, which talks about the website, but there's no interpretation here that we are to note that they are expected to notify customers of unplanned outages in real time or in advance of that. Is that correct?
Certainly not in advance. The planned versus unplanned outages, planned, of course, intuitively would mean if there's a service upgrade or some sort of scheduled kind of maintenance. And then they must notify the customers at that point. An unplanned outage, how could a utility or any company know of it? Because it is indeed unplanned and spontaneous. And so notification would probably come as soon as feasible, practically possible. And then certainly after the fact.
Is that clear enough in your mind, or do you think there would be opportunities for clarifications to that if people have concerns with the possible interpretations?
It reads plainly enough to me. I believe that the E911 board also reviewed this language and to a degree found it acceptable. Those are just two perspectives. So maybe. And I don't want to go too much detail.
If a tree goes down and cuts me off from 911, I'm not able to communicate to whoever needs to know the trees are cutting or crossing wires. But if a tree comes down and cuts off the town of Brookfield from getting emergency notifications, how does our system notify the people of Brookfield through a different route from the one that the tree fell?
Communications.
Yeah, radio alerts.
There's also satellite as backup. Radio towers which don't rely on the lines.
I don't think I'd be able to provide you with a technical answer. Rather technical question. I apologize.
Our job is to see the technical things are completed and operate. So
Senator Watson's in the room, and she's moving around in a way that suggests to me she has information.
Senator Brady, you're an expert at noticing people moving around in such a way. Senator Watson.
Thank you. I guess I would just point on page 47 to line 16 and the subsection 2 there, just in general, that part of the requirement is that they should know or include at a minimum posting about the outage on the website. So if someone still had access to the internet, even if their telephone lines were down, that that notification might happen that way.
Via their cell connection on their phones.
Can I say something? When we looked at the climate vulnerability index, it's a national index over the fall. The identifiably most vulnerable population in Vermont were rural seniors. Largely because of the issues you're raising, if they don't have a smartphone, if their power is out, etc. If they don't have a neighbor in their building or close by who reaches out to them, they are at risk of, some kind of personal damage or harm because of their isolation, essentially, and their lack of ability to communicate out. So there's redundancy in a lot of systems, but I would say I took away that we do need to keep our eye on how rural isolated seniors get information or don't, because they are most vulnerable in a climate emergency.
It's the question I was asking.
Yeah,
If you live on a dead end road and you're cut off,
right.
other than cell towers,
Yeah.
getting it from there.
We have not developed a good enough answer to meet that vulnerability. I would say.
So who's in charge of that?
We can yell at Eric for you.
Pardon? Who,
At Eric Forian, the Emergency Management Director. I would say. Senator Watson might have another opinion.
I guess if you are planning on having Barb Neal in, this was language that was suggested by her. From the E911 board.
So those two were on our list, but I think what you're getting at is an accurate assessment that regardless of redundancy, you almost need to have adopted a neighbor and to have some strong community connection so that you're checking on people with disabilities and seniors at person to person.
unless you get your ski poles and you go to your neighbor, but in the meantime,
Yeah.
when a system that has a lot of dead ends is down, what are the backups in the system? Not,
Yeah.
not getting the sled dogs out.
Or having a generator of your own, or, I mean, now I would say that my husband's been wanting a generator forever. And then we got the Tesla Powerwall through Green Mountain Power, and that acts as a generator. So the more people who take advantage of that very cost-effective way to get a generator, it's actually not just beneficial for an EV, it's beneficial in a disaster.
For those folks who can get generators,
Mhm.
it's not a, perhaps they can solve the problem themselves. What is the,
No, I know, but Tesla
State's
Powerwall will
policy.
fund the financing,
And
so there's
who
gonna
will
be a
be-
commercial for that. for
who-
Green Mountain Power.
should we hear from to see that when things communication is severed,
Mhm.
how is communication instantly reconnected somewhere else?
Like a ham radio or something, I mean, really, it's like, whatever's a redundant communication.
You're
system.
just, the whole issue, redundancy, in
Yeah.
terms of where we ought to be moving. It's
Who's the
redundancy.
commissioner of
And
redundancy?
redundancy in connection with the 911 system, which right now does not have it, despite the
Right.
claims to the contrary.
Right, so that still speaks to those two witnesses, right, Eric Foran and Barbara Gill.
We could talk to the Department of Redundancy Department.
We could have two of them.
The Ways and Means passed a bill decades ago that had ham operators license plates so that in an emergency you could hail them over the side of the road and communicate, like what happened in South Barry, where they had the gas explosion. And the only way the fire trucks or whatever were notified
Yeah,
through a ham radio operator.
right,
But we come a long way in 2 decades. So what replaces ham radio operators as a standard policy? And Barb O'Neill's the person who's gonna answer this question.
or Eric, who is in charge of emergency management and therefore emergency communication, and telling you if we're missing something.
Mr. Chair, I think we could also invite Commissioner Morrison in too. I think
Right.
she has a lot of
Yeah.
perspective at the municipal level of what the radio towers are done. And there's times when the internet service is down and landlines and how they can also default back to satellite communications. So Jen, that'd be another person if you want to hear from there.
Well, I will pass those suggestions along to the chair and see if she's got some time to take a look at it. Senator Breyer.
Thank you. I would just like to, crossing committees here a little bit. Would you be willing, please, to, or let me know if this is not something I should be asking you, on the emergency powers, section, part 10, if you might check in with Mr. O'Grady, because we had another suggestion about emergency powers that arrived in our city. And I make sure that what we looked at it there, these two things aren't doing this. So if you could, Mike O'Grady took care of it for us, on that. Thank you.
We've been down a long winding road and we just wrapping up. We just speak to about the emergency management communication.
Okay,
How does it work and how perhaps does it not work?
okay,
And we ask the committee to speak to us.
and this is 310,
Pardon?
on 310 flood preparedness. Okay. And I understand that there is wording being worked on for the communications. This is the 911. Yeah, so I've heard there may be some language brought to us. You may be the last to know.
I think I may be.
Language.
If they agree, then they'll come over
Nine-one-one.
or find one of us to find you. Okay,
Our committee,
right, what?
our committee would get that language.
If it's to go in the bill, yes. I understand there's some concern amongst the wireless carriers about their ability
Yeah.
to notify all their customers.
Right. I think that tracks with what we heard, that they were heard late by GovOps.
Yeah.
And she doesn't want us to kill that section, but to work on it. So I think that's,
And does the bill say that, because
yeah, so
I spent a while on Monday talking with the chair, that it would be putting it of notice on the website? Is that in the bill presently?
Yes, for languages and services, let's see. This is on page, bottom of 47. Senator Watson did just reference this. This provision that says notification of outages described in the section, that is when 911 is down, this is 911 calls them down, shall include at a minimum a posting of basic details regarding the outage on the originating carrier's website.
No, you arrived at the moment of,
You just finished it.
it's like the conductor going like that and then they come through the door.
Okay. So,
And we also want to hear from the person who notifies us of unfolded houses.
okay, I'll leave that to you to find that person. Okay, so
Who plans that, Jeff?
I guess. I don't think, well, sometimes there are planned outages when they're doing work and they will tell you it will be out on your street, like water.
That's a
outages.
plan.
Okay.
Welcome back.
I'm not sure I want to be that.
you were very restless.
We want to-
Yeah, oh, yeah. Okay, so who do we want to hear? We want to hear from the wireless carriers. And I will leave it to them to work on some, compromises. Any,
Eric Moran, Ted Prince, great.
I believe so.
And, wherever Neil.
Neil and Eric, yeah, he is from emergency management, right?
And Tom suggested Jen Moore.
If you're so inclined to understand the redundant layers of communication. Person to speak to.
Well, and also them managing this fund.
Greatly. This is the town fund.
Yeah, I mean, I think they're all kind of how. This is a new $15 million.
Yes,
Yeah.
and we've been asked to, it's pretty certain that the $15 million won't make it through appropriation.
Right.
So we have been asked to find an alternative since this originally had a fee on insurance, property and casualty insurance companies.
Yeah.
Who felt rather strongly because they don't carry flood insurance, so
Right.
we prevent floods, they won't benefit. So we might as well tax life insurance companies too. So that came off. I know the other, the ops would like us to find
Right.
some money.
Well, part of my question was, should we seek some signal from appropriations about both the 4.5 million for flood safety and some amount of money for this and try to find a singular funding source that helps us with flood management and mitigation in both contexts?
We could try. We have 4 days.
Yes, that's a good one.
Yeah, this is crossover.
Right.
I know it will, all of these will go on the wall.
Mhm.
Doesn't mean they're not gonna get funded, but when they go through the budget,
Yeah.
then they have the ability to look at what we've got and then prioritize the budget.
Right.
This year is just worse than most.
Right, it might, I mean, just given what we've been through in the January windstorms and on, it might just be good if we spent time, even if we couldn't accomplish it in 4 days, on some kind of disaster revenue
Yes.
source.
And it would be easier if we could find somebody we could blame for the disaster.
Right, well, I know, we are gonna hear climate superfund that's gonna take a
Yes.
long time to do that.
Yes, I mean, that, if we can come up with that, that would be very helpful.
Mhm.
But try to find an individual,
Who should we blame for that?
yes, who should we blame?
New Hampshire.
New Hampshire, always New Hampshire to blame, Canada. Because the winds blow down from there or something, but, it will be a challenge to come up with something, but, and, but we can establish the fund, have it in place, and then when money is there, we can put it in. I know some of the towns, I was told yesterday that Montpelier is hiring an executive director for its resilience committee. So they are going
Like a paid,
a paid position, which,
chief resiliency officer of some kind.
of some kind, but, that's, so
Yeah.
we need to make sure what we do gets coordinated with. And there's all kinds of other towns that are doing resiliency, and we should make them all go in the same direction, like Palm River. And
When I was presenting 213 in appropriations, it didn't get tied to it anyway, but, Senator Sears was reminding the committee of at some point we may have a super fund.
yes,
And that would be money very appropriate for this. But, I think everyone realized that those money might be many years away.
yes, I have a feeling they'll spend some time in court before they have a chance to be given out. Has that bill come out?
213, yeah, it's on the calendar.
No, it's the Superfund bill.
That's on the calendar too.
Is that on the calendar?
It's voted out of judiciary 5-0.
Okay, good,
So it might have gone to approach from the notice calendar today.
okay. Okay, so on this one, we will hear from the 911 people, Eric Foran. But our jurisdiction is really the funding, we'll walk through the whole bill. But my understanding is the one place there's controversy is whether or not the wireless companies can do that notification on customers. Since some places, their customer could be in California, why not notify them out of so. We'll take that one up and we'll hear from the folks involved in that. Okay. Thank you. First time in this committee?
I was here, I think once
Once?
last session.
Okay,
It's nice to be back. Thank you very much.
well, thank you. Yes,
We started, just so you know,
yeah,
what we were doing. We started, I was walking on 305 while we were waiting for Senator Hardy.
Yes.
We paused in the middle of it when she arrived.
okay. So do you want to finish? All right. Your explanation? We have one other thing. I don't think we'll get another Passover for the auto insurance bill, so if we want to do any kind of an amendment or not, this will be our last chance. So you can be free of bottom.
Okay, so everyone has a hard copy, of this one on your paper. And we have done the first 5 pages, and since you were here, what I just say, we read first half addresses the pilot program that we call the Energy Efficiency Modernization Act. It's 3 years from 20 to 23, we reauthorized it last year from 23 to 26. There was some question on interpreting the language across the street, discussions back and forth. So there is no substantive change to this program. It operates the same with the same goal, but the language is modified in order to make it clearer for the department and the feeds to in terms of our intent to fully fund the program for 3 years. And that took us to have to answer your question if you like, but we finished that and we were on page 5 for the second half of the bill. That's into some, 2 things, some technical edits from the PUC on cross references. We call it the PUC standard. So if you want, I'll pick up there, or I'm happy to answer questions on the first.
I will, any questions? This bill is not coming to us, is it?
No, went to,
Okay.
you and I thought it could come, but
That's what
because it wasn't gonna be referred to
That's right, we
31,
tried to get that
it would
here.
have been a policy bill referred to a policy committee in that sense. And the secretary found out that it would not be crossed.
And we thought it might be a vehicle, all right. Because it's PUC and it's PUC that the regulations for Rygate.
Right.
What I've learned today is that Rygate has not worked out a compromise that they think they will have by the end of this week, so we can use the ag bill and leave it to the House. Representative Bobby Fairlays Rubio is working on a compromise with them. And I think what I told them is the least we want is some guarantee that their suppliers would be paid on time. That's the standard we're working on right now. If they don't work this out, then they lose the public power, their 7 cent above market that they're getting for every kilowatt hour, so. They should at least agree to pay their workers. On time.
So, cleaning standards, begins on line 12 of page 5. So the, I'll just go through the edits. They're quite narrow and technical. The change on 1920, it basically the commission, it receives a lot of information from Department of Tax, right, based on the taxes on fuel. And that the point of that was so that they could make sure that their registry of fuel oil providers, vendors, was complete. So it's it's kind of an auditing cross-check. Tax shares information with the PUC. Tax shares more information than these companies would feel comfortable seeing shared publicly. So the PUC wanted to specify that, yes, they're sharing a list of registered entities on their website, but we strike that contains the required registration information that allows the PUC to withhold proprietary information.
Okay, that's good.
The next page, page 6, so this is in the Affordable Heat Act, we have many different gears turning to make the whole thing unfold, develop, get implemented. A year ago, we thought that a useful date would be to specify that the default delivery agent should be named by June 1 of this year.
I think it's gonna happen.
That's a bit of a cart before the horse, the way the process is unfolding. The department and the PUC have successfully hired people. There's a large group of people working on it. I think maybe 8 to 10 in total. And they said this date doesn't make sense there. So it's coming up shortly. So that's why I was saying it was a tiny bill. And everyone in the room agreed this was a date worth removing. It's an internal, and let me pause. It's an internal milestone on that whole 2-year pathway. It has no impact on delivering the final rule in January of 26. Everyone adhered to that end date, but said, can we adjust our milestones along the way? So that's the first milestone that gets adjusted. Then the second milestone is on page 7, and I'm going to do the bottom of the page first. So they said, well, what would be a useful milestone for naming a default delivery agent? And the suggestion was to use in lines 19 through 21 the approval of the first 3-year plan and associated budget proposed by a DDA to the PUC. That should happen by September 1 of 25. People agree that made sense. Yeah. Dan.
For those of us that aren't immersed in
Oh,
this,
yeah, sure, sorry.
we sent the whole Affordable Heat Act to the PUC.
Yes,
I've read, and they have to report what the problem and the cost, which were
yes.
the big concern, the cost
Yeah.
to individual Vermonters, back to us, the plan with numbers. So what is, it's PUC shall approve whose 3-year plan?
Yeah, so thanks. We're in the section, default delivery agents. So
So
some,
what is a default?
right, so if you're a fossil fuel vendor
Okay,
and you're gonna have a pro rata obligation, right, to go to clean heat credits. So basically an offset to the emissions associated with the sale of
okay.
your
What
fuel.
I never understood is who buys the clean heats credits?
So in essence, the obligated party, the fossil, the
The
fuel.
oil company, oil.
You sell X number of gallons, you'll have an obligation to basically like Rex or renewable
Yeah.
energy credit.
Yeah,
You'll reach in a certain way, like retire a certain number of clean heat credits. And a clean heat credit is generated by doing something that reduces emissions. So it could be putting in a heat pump, it could be weatherizing, it could be a pellet stove.
okay, but that's, you want the fuel companies to put in a pellet stove or to put in a heat pump.
Well, they have a choice here. So one is some companies have said, you know, all I want to do is sell fuel.
Yes,
Tell me how many credits I'm gonna own. And then I'm gonna get them someplace else. We want to make sure there is a someplace else for them to get them.
Yeah.
That someplace else is referred to in the program as the default delivery agent. So if you're not creating your own clean credits, you can say, I'm not interested in, I never sold a heat pump in my life, I don't want to get into that.
well, I don't want him putting one in my house if he's never put one in.
Okay, fair enough. So this
Or wood
is,
stuff.
I just want to know how many clean credits I owe as a
Yeah,
vendor. I'm gonna go to the default delivery agent and acquire
okay.
them. So this is, okay, when
So
are
he's
we-
going to pay the pellet stove vendor X amount of dollars, which represents the value of his clean heat standards, to put in a pellet stove for somebody?
yeah, in essence, installing a pellet stove will lead to over fossil fuels, will lead to a certain amount of reduction in terms of greenhouse gas emissions. The technical side of this program will tell you how many credits that activity generates.
Okay, but
So-
basically you're asking fuel oil dealers to pay to put in equipment, machinery that will reduce their sales or their profit. So you're asking them to pay to put themselves out of business?
Well, you can say it that way, but it's, you might also look at that the person they're selling to may have no relationship whatsoever to where that weatherization took place or clean heat pump went in someplace else. It doesn't have to happen, and if I sell
So
to
you
you,
just, so
you
you
don't
just
have
pay
to
a
have
certain
the
amount of
clean
money.
credit measure at your house.
Okay, so you just have to pay a certain amount of money into a fund, which would then,
Be used somewhere in Vermont to reduce emissions.
You could be the recipient of one if you install heat pumps.
I have been told by two people that
Pellet
two
stoves.
two technical people I've had do my house, and they have said you would be totally inefficient and do not put in heat pumps. I think I need something like 14.
That's small.
It's
A big long house, 3 basement. Yeah, and attic, and there's a room in the attic, so, yeah. So I'm just trying to,
Yeah, no, I get it. So, I mean, probably the easiest analog is to think of what we do with electricity and efficiency alone. Each bill, you pay in some, the electrical energy efficiency charge.
right, but I pay,
You pay.
I,
All electric purchases, can get electric
Right,
efficiency.
but this is
Right,
the
this is not-
company that's, you don't ask Green Mountain Power to pay to cut down on how much power they're selling.
Well,
I'm just trying to figure out why it's.
sure,
it's different.
so maybe the analogy is not perfect. In that case, though, we do ask ratepayers to pay in.
Yeah.
And we have bent the curve. One of Vermont,
We have,
20 years ago, started bending the consumption curve that all over the country is just ramping up. We actually curved it back down. So, you know, you could say that,
kept the price.
measures that customers have helped change that
Okay.
curve. There's an indirectness about this because, as you might recall, the obligation lands on the person selling you the heating fuel.
Right,
Everyone said, I think this is probably likely, any kind of cost associated with that
it's
heating
going to go
fuel,
on to the,
they're gonna add something probably to a gallon. We actually had a study that came back and said, in year one, it estimated a penny a gallon. Year two, a penny a gallon. Year three, a penny a gallon. Year four, 3 cents. Year five, I mean, so a long way away from the 71 cents a year, 71 cents a gallon hyperbole we heard a year ago. Anyway,
well, who says that? There's gotta be a control that says you can only raise it, but the price of gasoline just jumped 5 cents overnight.
Right.
Downtown Montpelier, I got it on the high side.
Right.
There's other factors that are going to go into it, and who's gonna monitor?
so the program itself is gonna monitor the cost of credits as it runs. I mean, we have to stand up to the system and get it operating and see what these credits cost. But at any rate, ANR asked for a study that came back in November and it indicated that it estimated in years 1, 2, and 3, it would add a penny to the cost of fuel. So you just saw a nickel on a gallon of gas. Right now, at least to launch the program, it looks like it will be economically, manageable. So
Well, isn't that
but
what the
we will know
PUC
a
is
lot
supposed to
more
be,
before
those were
we,
the numbers the PUC was supposed to be developing, right?
yes, so this was a study that ANR led. It wasn't just focused, it was talking about how to reduce emissions in the thermal sector broadly. And it said, oh, one scenario that may well play out in Vermont is the Affordable Heat Act moves forward. If that moved forward, what would happen? And so they gamed that scenario out. But to your point, before a future legislature decides to enact fully through a formal bill sent to the governor on the Affordable Heat Act, we will know much more definitively what the costs will be.
Did I hear somebody was asking for a year extension?
Well, some people were thinking about that, but this bill is,
It does.
fixed exactly through January 26th to launch the program or bring it to the legislature for consideration,
It was January 25.
January 26th. That's
Okay,
that's when the
yeah.
finished rule was there. When the legislature will take that up and
we'll know what the numbers are.
we'll know the number.
January 25.
It takes them all the way through 25 to finish the process of rulemaking and standing up to, figuring out the details of the program. So what this is doing is on the way to January 26th. What milestone makes sense? Now, they have 26 open dockets underneath the Affordable Heat Act for all the different gears that have to operate and mesh. They said, okay, what we would like you to do is look for a different milestone that now that we're more knowledgeable than we were a year ago, makes more sense in terms of seeing the orderly development of a program. And the suggestion was that on the bottom of page 7, we use the delivery to or an approval by the commission of the first 3, so a DDA they need to come forward, they need to propose a 3-year plan and associated budget for active serving as the DDA. It could be statewide, you know, it might be a lot like Efficiency Vermont, one entity providing services everywhere. There could be many DDAs, but you know, it's an open process. We'll see how many people show up. But at any rate, we need to have a 3-year plan and a budget no later than September of 25. That's the thing they want to hit, because that allows them to be timely for bringing something fully baked in January 26th. So once you use that date, then at the top of the page, it said, when will, default delivery agents be notified of the, cost prior to enactment? It had said 120 days. Well, September 1, the proposal on the bottom of the page, it's only 90 days prior. So we said, okay, we can't give 120 days notice because we won't have that budget until September 1. So we trimmed 120 days, basically August 1, to match 90 days, September 1. And those go hand in glove.
Okay,
And that's the new milestone, and that's the new performance obligation. You have to have 90 days of this to company selling fuel. And that's to give them 90 days to think about, do I want to make my own clean heat credits by having to sideline my business that does weatherization or heat pumps or wood stoves? Or do I say, you know, all I want to do is deliver fuel? I'm going to choose to use these other guys, you know, buy them. And the reason that's important is because if you're the DK,
is 90,
you want to know how much business is coming your way.
is 90 days enough? People buy their fuel, pre-buy
Right.
in July, so you've already got a deal, this is what you're gonna get, and now we add a cost in September. So we're gonna have to transition there somewhere.
Right, so, you're right on the money, that question came up. Yeah, when we asked Mr. Coda, what do you think the answer ought to be? It's currently 120. He said, actually, I would prefer 180 days. But no one will know 180 days prior what that cost will be. So we set it on 90 to align the dates.
And as we get closer, things will
Right,
change.
well, that's the other thing, so.
What have
And
done
like, saying all the
any,
right things from my point of view, we're gonna have another whole legislative session while this
Yeah.
thing is churning its way
True.
along. It would surprise me if next legislative session, someone doesn't say, we're now 9 months further in and we want to adjust the dates
Yeah.
further.
well, I had a constituent last year, lives up in the woods in Orange. She couldn't get a fuel dealer to deliver to her. So if you might find a constricting market where they'll deliver to Montpelier or Barry, but they won't deliver out in the hills. Cause that already seems to be happening. That,
Was it propane?
no, it was fuel oil. And she couldn't get anyone that would agree to deliver to her home.
I don't think this bill would change that.
If you up the cost to the dealer, they might try and constrict their overhead. And that would say, we're not gonna deliver more than 5 miles out or 10 miles out. And they can do that. And that might leave some folks in rural areas in top area. I think we all look at that.
Yeah, I mean, that,
And what's our alternative plan? How are we going to get affordable heating out
yeah, the bill doesn't,
folks?
In the summer, too.
you know, push or retard any fuel vendor from taking its own decision.
Oh, we don't now.
Right, saying the status quo on that side of things. I mean, I'm acknowledging that problem for someone who's particularly rural.
Mhm.
And maybe they're not a big user of fuel, something
That's
less enticing to go out there. But the bill at Senator McDonald says has no impact on that. But
Okay,
we're-
no, this bill is not, it's just as we finalize. I just want to make sure that especially lower income people don't get hurt by this, and I don't mean poor people, I mean people just above that line. So they don't qualify for help. Only 25% of our population then is of retirement age.
Sure, and I would expect you to have, since I lived in this bill for the last year,
It takes us a while to pencil.
it is designed to focus, initially and primarily on low and moderate income Vermonters.
Well, it's the definition of moderate, I think, that we might want to look at. Because moderate on a fixed income is different than moderate on an expanding income.
The ones that are getting squeezed for the last 4 or 5 years now.
Who?
Low and moderate income people
Oh, I know.
under the current
I'm
system.
also boycotting Cal's.
The,
They hiked up their prices even though they didn't have a high cost.
You want me to, that completes the date changes.
Okay,
We strike one that's impossible actually for people to meet,
yeah,
and we find a substitute.
Okay.
Which was the DDA, the program budget, and having that effective. So down on page 8, down the bottom, you see a cross reference. It actually was more, should have been to the subsection we're in as opposed to the full chapter. That gets corrected in a similar technical way on page 9, line 9. Because of remembering a 1 becomes a 2. Bottom of page 9, line 19, because we add one more section and gets shrunk, added, but it's not an ultimate section. And then we add an and one new section on Canon. And that is, so this is in the section about data from tax coming to the PUC. And last year when we passed it, we just said, give me data next year. Well, the PUC said, wait, how are we gonna keep our list up to date unless annually we can reconcile our list to your list? So this adds them to the list of getting heating fuel data for use in assuring compliance with the convenience standard that we passed. The last thing, because of that date coming up pretty soon, June 1 is not far away, really. So it's this effect on passage that was originally 7/1/24. And that is 305.
okay. Any questions, committee? Okay, final decision of the day. Does anybody want to make an amendment to change the automobile insurance 150 as it came to us? It will probably raise, I don't know, we're not such a small sector, but it will have an impact in probability of rates.
We can get the bill, so we're not voting, right?
No, I asked Senator Sears to pass over it because it was, and then I found out in some kind of a swap that went on many years ago, automobile insurance got done to judiciary. So we do not have jurisdiction if we felt that it was going to have a major impact, or at least this time I haven't been accused of selling out to the military industrial complex when we asked to look at the.
Again?
Again, yes, because last time this committee asked to look at the strict liability in the Bennington bill. It wasn't done anywhere else in the country. We did pass it out and say, we just asked to have the cost of the insurance monitored. So
I'm comfortable with the language as passed by the issue.
I'm not seeing anybody dictating, so I will tell Senator Sears, as he will anyway, put his bill on the floor. All right, tomorrow we got 4 bills. Have you got that list saying? The top ones, okay. Okay, S-259 climate change cost recovery, is that?
That's the super.
That's the super PAC. Okay, we will take career and tech ed, telehealth. Telehealth, we have a lot of people. This is the in-person and telephone, and do they all get paid the same? We have lots of people, and DFR is flying back from a conference, so we couldn't get them this week.
Okay, so I heard from a lot of people today,
I'm gonna
felt
put it on
confident.
next
Oh, okay.
so that everybody has the time to come
To
in.
be heard.
We've done miscellaneous ag, so we can vote that out. And we went over 310 today, so we will have Barb Neal and Eric Foran. Head of the state police agent. But that bill, really, we don't have, just the telecom part. And if I understand there's some language being worked on with the wireless providers, and so I'll give them time to bring that in. Miss Ag can go, telehealth is off till next week, so, yeah, so tomorrow we will get the, walkthrough on the climate change, cost recovery, and career and tech ed. And then I think career and tech ed, I don't know what, there must be a fee in it somewhere. But I think it's gonna take us probably Thursday and Friday to, just because I have a feeling there'll be people that want to talk on the climate change cost recovery.
I tried to scan it, I don't know if it was a fee so much as like looking at changes and finance pathways for students.
For kids,
Yeah.
yeah,
I could be wrong, but I just.
and climate change cost recovery. I don't know, I haven't gotten emails how much pushback they got in judiciary, but we'll put it on the agenda and see what comes out. I think that will keep us, so tomorrow, Wednesday, we'll go through those two. And let's ask the clarification, one of the sponsors of that bill is to come down and talk to us. We might be able to get career education out. And then we will use climate exchange. I think,
So telehealth does continue this week.
yeah, no, it's an H bill that got sent to us. It came up 2 years ago, maybe more, than we allowed everything during COVID. And they're starting to ramp down. When I was in health and welfare, it got sent to DFR to work something out, and that's the kind of running. So I want to have DFR in for the last, I think, 3 or 4 years. Insurance companies have been paying 75% of what they pay for in-person or telemedicine, which is, you can see the person for what they're doing, for phones, doctors, so the providers would like to get 100%. The insurance companies will cost your insurance, so I want to have DFR in mostly to tell us what reasoning they use to come up with that number. So, but we can do that next week. I think we're gonna get this done without having, I feel like I've been 2 weeks where we didn't stay until 10 o'clock on Fossil tonight.
We're not even using the lights.
No, we aren't, and standing, but, yeah, there just aren't as many of those. I don't know, second grade. One year we got 5 net metering bills in 1 week. I got an award because we passed them. I think we did 3 in 2 days.
We'll see that hearing again, when the legal entities. With,
The other balance is, we've got to make sure that we keep the rates affordable. Because 7, 8 years ago, you couldn't sell a house with electric heat in the state, and it was the cost. Yeah. Well, all the condos in Montpelier have gotten off electric storage heat and gone to natural gas or propane. So,
well, a lot of those in, Quebec, because their power is so cheap that even though it's the least efficient way to heat, they had a super abundance of electricity. Now they're saying, well, now we see that's really not the best plan for us, and they're starting to.
So, yeah, my son has this big kitchen, it's all radiant heat. Through all radiant, too cheap to buy.
It's turning up the power, they can make more money. Just like we found a way to make it cost effective and save like the state. They're looking at efficiency Vermont, to help them save electricity, because if they free up that electricity, they can make more money selling it to us than just consuming it concurrently.
You have too much supply and demand. Too much supply and no demand for prices. Oil companies are taking it out. Okay, I think that's
These are
it.
chairs.
Right? I thought it got canceled.
There's no church meeting.
No chairs,
No
we
chairs.
You don't have anything to talk about?
Well,
We are